Dentistry has the reputation of being kind of a scary place. There's needles, there's drills, there's lights, and typically it's a procedure or a place where people are not comfortable.
Typical patients who are fit for anesthesia include those who have an anxiety or fear of the dentist or healthcare providers, patients who have a significant amount of work that needs to be done, patients who are unable to cooperate.
We work a lot with children, and children especially don't understand dental procedures and have a difficult time cooperating for them. You know, they're going to be a little bit shy, they're going to be a little bit nervous. Generally they know that they're coming for a dental procedure, and they may have a certain understanding or a certain fear of that procedure. So our first goal is getting to know the child and creating, you know, some level of comfort and some level of trust.
And that can typically involve playing games, talking to the child, spending a little bit of time getting to know the child, what he or she likes or dislikes.
We continue that relationship on into the dental operatory, trying to play games with them and trying to get them comfortable for something that may be intimidating.
Another benefit for doing the procedure under anesthesia is you're allowed to get the whole case done in one visit rather than coming back for multiple visits, multiple appointments, and it's much more efficient to do it that way.
At SedaDent we bring in hospital-grade anesthesia machines and monitors. We'll bring those directly into the dental operatory, and we'll convert that that dental operatory into a mini operating room.
I use an anesthesia machine, as well as the same medications and drugs that you would find in an anesthesia case done in the hospital.
Many parents ask me how the anesthetic is administered. It's either a needle, which is uncomfortable, or an injection, which is also uncomfortable. There's medications you can drink, but those typically prolong recovery. One of the benefits of bringing hospital-grade anesthesia machines into the office is that it allows us to do what is called a mask induction. And basically what that is it allows the child to breathe a gas and in the process fall asleep. After which, we can do some of the more traumatic things like starting an IV or placing a little breathing device.
3 advantages that most dentists mention when they do cases under general anesthesia. Number 1, their efficiency increases. Number 2, the time that it takes to complete the procedure significantly decreases, and the quality of work is raised as well.
One of the things that I really enjoy about being an anesthesiologist is seeing a child who has had a negative experience or who feels like they're going to have a negative experience come into the office and be able to receive a significant amount of dental work and then wake up from the procedure not knowing, 1, that they even had anything done, and 2, that they're comfortable and ready to go home, and that just that kind of smile and as they leave the office, I think, is one of the most satisfying things about being an anesthesiologist.